Hey everyone, welcome back. Today we're diving into something that's probably sitting in your kitchen right now. Onions. I know, not the most glamorous topic, right? But what I'm about to share is going to blow your mind. Last month, I came across this study from Johns Hopkins that tracked over 3,000 people for 5 years. The group that ate onions regularly, at least 5 times a week, had significantly lower rates of heart disease, certain cancers, and metabolic disorders. The numbers were honestly staggering, so I went down this rabbit hole, reading dozens of peer-reviewed studies, and what I found was game-changing. Today, I'm breaking down exactly what happens inside your body when you eat onions every day. 4 major benefits backed by solid science, who should be eating them, the best time to consume them, and what happens long-term. No fluff, just facts. Let's get into it. First benefit, your blood sugar becomes incredibly stable. Let's start with blood sugar control. And this is where onions become fascinating. There's this compound called chromium in onions that most people have never heard of. But chromium is essential for insulin function. Your body literally needs it to process glucose properly. A study in the Journal of Medicinal Food took people with type 2 diabetes and had them consume 100 grams of raw red onion daily for 8 weeks. The results? Their fasting blood sugar dropped by an average of 40 milligrams per deciliter. That's the kind of drop you'd expect from medication, not from a vegetable. But it's not just chromium. Onions contain quercetin, a flavonoid that increases insulin sensitivity by up to 30%. What does that mean? Your body becomes way more efficient at using the insulin it produces. What really caught my attention was this 2021 study from South Korea. They looked at what happens when you eat onions with high-carb meals. The group that added onions showed a 28% reduction in post-meal blood sugar spikes just by adding onions. And here's something practical. Red onions have the highest quercetin content, about 100 milligrams per 100 grams, compared to yellow onions at 40 milligrams. So if blood sugar control is your goal, go red. Second benefit, your cancer risk drops dramatically. This is probably the most important benefit, backed by some of the most robust research I've seen. I'm not saying onions cure cancer. That's not what the science shows. But regular onion consumption is associated with significantly lower cancer risk. A massive study in the American Journal of Clinical Nutrition followed over 120,000 people across Europe for more than a decade. People eating onions more than once a day had a 50% reduction in gastric cancer risk. 50%! Research from Italy showed high onion consumption was associated with a 56% reduction in colorectal cancer risk and 43% reduction in laryngeal cancer. So what's happening? Quercetin neutralizes free radicals before they can damage your DNA, and DNA damage is the first step in cancer development. Studies show quercetin induces apoptosis, programmed cell death, specifically in cancer cells, while leaving healthy cells alone. Then there's the organosulfur compounds, the ones that make you cry when cutting onions. Research from the National Cancer Institute found these compounds can modify gene expression involved in cancer development. Your diet literally affects how your genes behave. One Japanese study from 2020 looked at onion extract's effect on breast cancer cells. The extract inhibited cancer cell growth by 70% within 72 hours. Compounds in onions also inhibit angiogenesis, the process where tumors create new blood vessels to feed themselves. Population studies show that in regions where onion consumption is high, Mediterranean countries, parts of Asia, certain cancer rates are notably lower, even when controlling for other factors. Third benefit, your heart gets a complete overhaul. Your cardiovascular system is like a highway network that gets damaged over time. Inflammation, cholesterol buildup, reduced flexibility. Onions are like a complete renovation crew. A landmark British Medical Journal study tracked over 20,000 people for 15 years. Those with highest flavonoid intake had 20% lower risk of dying from heart disease, with onion consumption showing an even stronger association. A meta-analysis of 17 clinical trials found that onion consumption reduced LDL cholesterol by an average of 15% while increasing HDL by 8%. But it's not just cholesterol numbers. It's about endothelial function, how well your blood vessel lining works. Research from the Netherlands showed that, after just 12 weeks of daily onion consumption, participants had 23% improvement in endothelial function. That's the kind of improvement you'd normally see with exercise or medication. There's also the anti-thrombotic effect. Onions make your blood less sticky, reducing clot risk. And for blood pressure, a randomized, controlled trial from Iran showed that consuming 100 grams of onion daily reduced systolic blood pressure by 10 millimeters of mercury, about the same as some medications. Fourth benefit, your bones get significantly stronger. This surprised me, but it makes sense. After age 30, you start losing bone mass, accelerating dramatically after menopause for women. A University of Bern study found that women who ate onions daily had bone density 5% higher than those who rarely ate them. That translates to 30 to 40% reduction in hip fracture risk. Onions contain peptides that inhibit osteoclasts, the cells that break down bone, while promoting osteoblasts that build new bone. Laboratory studies showed up to 27% reduction in bone loss. Onions are also rich in vitamin K, crucial for binding calcium to bone tissue. One medium onion provides about 20% of your daily vitamin K needs. Plus, the anti-inflammatory compounds reduce inflammatory markers that promote bone breakdown. Who should eat onions and who should be careful? If you have family history of cardiovascular disease, diabetes, or certain cancers, onions should be on your plate regularly. Women going through menopause should definitely consider daily consumption for bone health. Honestly, if you're over 40, the comprehensive benefits make onions a smart choice. However, if you have IBS, onions contain FODMAPs that can cause digestive distress. If you have GERD, ulcers, or gastritis, raw onions especially can trigger symptoms. People taking blood thinners should be consistent with intake, as onions have natural anticoagulant properties. And if you're having surgery, stop eating large amounts at least 2 weeks before. And based on research, the ideal time is evening with dinner. Your liver produces most cholesterol between midnight and 4 a.m., and onion compounds can inhibit this synthesis. Quercetin also has a mild sedative effect, improving sleep quality. For blood sugar control, eating onions with your largest meal helps blunt glucose spikes. However, avoid them on an empty stomach, especially raw ones. And skip raw onions before important social engagements due to lingering breath issues. The benefits compound over time. A 10-year Dutch study showed people eating onions 5 times weekly had biological aging markers, equivalent to someone 5 to 7 years younger. A 15-year follow-up showed 35% fewer cardiovascular events. For cancer prevention, sustained high intake over 15 years showed lower overall cancer incidence. Studies on cognitive function found that regular consumers performed better on cognitive tests, with lower dementia rates. Bone density benefits compound significantly. Women eating onions daily for 5 years showed measurements comparable to women 10 years younger. At normal dietary levels, 1 to 2 onions daily, the long-term safety profile is excellent with no identified negative outcomes. So there you have it. Onions stabilize blood sugar, dramatically reduce cancer risk, renovate your cardiovascular system, and strengthen bones. Start with 1 meal a day, aim for 100 to 150 grams, roughly 1 medium onion, ideally with your evening meal. Choose red onions for maximum quercetin. Remember, consistency is key. The benefits come from making onions a regular part of your diet. Over weeks, months, and years, an onion costs less than $1. The health returns? Potentially priceless. Thanks for watching, and I'll see you in the next one.